Global deaths of newborn babies remain alarmingly high, particularly among the world's poorest countries. UNICEF's latest report on infant mortality, which ties survival of infants to maternal education, higher incomes and technological advancements, shows that while Pakistan is the worst place to be born in the world, Japan is the best. I had a chat with the CEO, Wellbeing Foundation Africa, Amy Oyekunle. She says more laws cannot hurt when it comes to protecting the world's most vulnerable, the children.
For us at WBFA, we said this was a watershed report. It was a very critical report that came probably at a very critical time in our history. We saw the data, we saw the statistics, and we were like, this is important. 80% of deaths in newborn are preventable. Some of the recommendations that came out of it validated the work that we've been doing, particularly with healthcare workers and midwives. So it said that many of these things require us to recruit, train, and equip midwives and healthcare workers in general with the right facilities for them to be able to provide a safe pair of hands. So this report was just, we tweeted and retweeted it, and we're using it as an advocacy tool for our work. It was quite unique, quite critical. The statistics are staggering, like you said. 2.6 million babies die within the first hour. 2.6 are stillborn. And you wonder why. Why are some of these things still occurring till now? For us, it is helping us to push our work further and maybe strengthen our advocacy, not just in the locations that we're currently working. We work in Lagos, Kwara, and Abuja, but even just across Nigeria in general.
Now, you did mention earlier, some of the causes of these deaths are actually preventable.
Yes.
And I have marked them into two: preventable, non-preventable. Those connected to labor and delivery, preventable. There are those that are also non-preventable, the premature birth. And like you said, this has been a conversation that's been going on for years on end now. Why does it appear like the world is moving around in circles?
So sometimes when we look at issues of child maternal mortality, it's huge. It looks like a Herculean task that cannot be done. So you have the healthcare itself, healthcare facilities, provision of adequate healthcare facilities, you have adequate healthcare workers, you have nutrition for children, breastfeeding, making sure that a child breastfeeds within the first 1 hour and then goes on to have at least breast milk up until 2 years. And we need to take it in chunks. So I'll give you an example. One of the things that you mentioned on preventable is hemorrhaging, women hemorrhaging. Now, one of the things that we talk about is right from the time a woman conceives, she needs to be under the care of a fully equipped, knowledgeable healthcare worker, aka a midwife. Some women in Nigeria will probably never see a doctor because it's not within their budget. And in truth, if you have midwives and nurses that are properly trained and they are properly given support to be able to access these mothers, then a woman can go through pregnancy, seeing her midwife, seeing her doctor. Anytime the midwives are trained to know when there's a problem. When a woman she has swollen feet, when she has certain issues, and maybe when the baby is not sitting right, the mother is able to talk to her midwife, and immediately this is taken care of. So this deals with the first months of pregnancy. The World Healthcare Organization says, ideally a woman should have antenatal visits, up to 8 antenatal visits.
Before childbirth?
Yes, during the time. In Nigeria, when we did some research, we found that women probably go once or twice, sometimes 4 times. So one of the things that we had to do was build people's capacities for women to be coming to the facility. That's where our midwives come in. They are at the facility when the women come for their antenatal checkup. We provide for them a safe space to learn, to ask questions with their midwives, to be able to share. That's one. The second thing is, at the time of birth, between the time the woman starts going into labor and eventually gives birth, do we have trained people there to receive her and to be able to deliver the baby? We just finished a 2-day tour of Kwara State, where we had our emergency and obstetric care for newborn, EMOC we call it. And the program, we're partnering with Johnson & Johnson and the Liverpool School of Tropical Medicine. We train healthcare workers, doctors, nurses, on simple procedures of how to be able to stop, for example, hemorrhaging when a woman is hemorrhaging.
Preventable
Preventable, just preventable. Most of the deaths, when you look at the women that they bleed. And we created for them a skills lab where they can come after leaving school. Some of these healthcare workers, when they leave school, that's it. They have to practice on human beings. They don't have where they can.
So now they get to work hands-on under the supervision of the Wellbeing Foundation.
Well,
Africa.
under the supervision of a master trainer that was trained by the Liverpool School of Tropical Medicine. That's another way. And you know, we've been doing this inquiry in 7 local governments. They've said they haven't lost one woman yet. Touch wood.
In how long now?
We've been doing it over 2 years.
2 years.
So
I do know that the Wellbeing Foundation Africa works closely with UNICEF. UNICEF has admitted upfront to saying that it's taking 25 years for the organization to record reducing infant mortality from the age of 5 under by half over the last 25 years. But it has not been able to record the same kind of success when it comes to reducing child mortality rate for children 1 month and below. Are you able to speak to the issues that may constitute challenges for the success?
So one of the greatest issues is probably the political will for this to happen. Because UNICEF, as you know, is a bilateral organization. So you have government, you have NGOs, civil society, and right now we're looking more and more to have private sector come in, like the Johnson & Johnson partnership that we have. So it's a collaborative effort by all involved to say we need to put this under control. One of the things that government does, which is critical, is create an enabling environment for this to happen. So it's not enough to say we're giving drugs, we're giving skills lab, but we have the law where women will be able to come in, access facility. We have health insurance for many people because out-of-pocket expenses is another issue that makes people say, oh, we don't want to come to the facility to give birth, we'd rather give birth at home under our mothers or under a TBA. No, many of them need to come to the facility. We have healthcare records for the mothers. This is something that WBFA created a few years ago, where the mother has a healthcare record, not just for herself, but for her unborn child. And when she goes to a facility, they're able to take it and know where she's coming from. What are some of the issues we need to look out for so that we can help her have a safe delivery?
Political willpower, collaboration, enabling environment. 3 key things that you have mentioned. Yes. And the UNICEF, under its Every Child Alive campaign, as part of which it released this report on neonatal mortality rates by country, says that essentially, these are the 3 key things that need to be done to achieve success in the reduction of infant mortality rates. Now, to what extent do you think that Africa is able to, come to the table now to be able to bring these 3 key factors together to achieve results in terms of reducing infant mortality? I mean, you saw the report. I'm looking at the figures.
Yes.
Nigeria has 1 in 29. Ghana has 1 in 37. Benin has 1 in 32, staggering figures, bottom of the chain.
In the last year, we've been talking a lot about universal healthcare, where more and more governments are looking at we need to provide access to healthcare for all. That's critical, that's important, and that's something that WBFA, our president and founder, Her Excellency Tony Saraki, pushes quite strongly. You asked a question, which is, to what extent do you think governments are ready? They are ready. When you see figures that say you're losing that many people, that many mothers, that many children, and these things can be preventable, then it's time to sit up and take notice. And they are ready because in individual states, for example, in Nigeria, many of them are passing, right now they're passing state health insurance. Let's have insurance for our people so that they can have access to money and facilities. Many of them are saying, let's revitalize our healthcare facilities. Let's create where in each local government we have a working healthcare facility. So they are ready, and donors are saying, look, we'll fund this. We're currently doing a program with FHI 360 on breastfeeding, where they're trying to push the narrative and say we want more women to be able to immediately after they give birth put the baby to the breast. We want children to be breastfed. So there's a whole lot of work going, Krista, that I think more and more governments government sectors are taking opportunity of, but the private sector is also coming in very strong. And CSOs, as you know, have been working extensively on things like this. So hopefully we would have a different narrative when we look at this a few months from now.
Well, as of now, you do come across like you are certain of a willingness, at least from
There
the
is
part
that willingness,
of the government.
yes.
But there are also researchers which prove that there is a connection, there is a close connection actually between infant mortality rates and the levels of income and education.
Well, I'm a gender specialist by profession, and one of the things we say is, yes, the more educated a woman is, the less likely she is to have that many children, the less likely she is to have children that she can educate. Exactly,
regarding a child's health.
Exactly, and provide education for the children. However, having said that, it's sometimes it's not as easy as that to say, oh, it's income that leads to better childcare and things like that. There's a whole load of social issues that go into socialization. And so we need to create awareness about, yes, it is important for women to make informed decisions. Education is critical for better healthcare outcomes for not just the mother, but for babies as well. So there is that relationship, and we'll continue to make emphasis on it. But I can't say that will change in a few years.
Now, from your experience at the Wellbeing Foundation Africa, to what extent would you say there are legalities or laws to cater for the protection of women in such a way that affects the rate of infant mortality in Africa?
Well, in Nigeria, for example, let me use Nigeria as an example. We have the National Gender Policy. We have certain laws that protect women. We are pushing for the Gender and Equal Opportunities Bill, which creates on it, it has an element of equal opportunities for not just women and for men. The issue, Christa, is implementation in many of those cases. And implementation is critical because it's not enough to say we pass a law, but how is it working? How is the state insurance healthcare scheme working? Are women accessing it? Is there a process of feedback? Is there a process of welfare, not just for those who can afford it, but for those who are from the lower cadre and the rank? So we have laws. Definitely more laws cannot hurt. But what we need to emphasize is implementation.
And collaboration. So right now, is the average woman in Africa able to say no to sexual relations with the spouse? No, in terms of controlling the number of children that they have, or put their foot down and make decisions regarding the well-being of the child, even from the pregnancy stage?
Well, average. What would you call average, Krista? Can you say no? Most times. I think that even educated women sometimes don't say no, because this is the environment that we find ourselves in, that we're in a patriarchal society where, to be honest, most dictates are from the male line, and you have to, it's a process of negotiation. That, okay, well, you know what, you want 3 children. No, I want 2. Oh, let's stop at 1. It's a process of negotiation, but not, the average woman cannot say that. Not yet.
The CEO, Wellbeing Foundation Africa, Amy Oyekunle.